So, you know how sometimes you've just got this kind of thing at the back of your head and or your worst nightmare or something that you really dread, something bad's going to happen and you kind of always think it's going to happen, but you hope that you're wrong. Well, it's happened now. So you can probably see the cranes behind me. Actually, I'll get on and I'll do a little crane update as well because I can actually just see them behind me. So anyway, yes, it's about my teeth, which is really ironic because online I actually get a lot of comments about my teeth. I get comments about my lips and my teeth. My lips have not been filled for a very long time. Unfortunately, at the time they were done, there was a little bit of a lump left. So that has kind of been a residual thing that has taken a long time to sort of settle down. It's going down slowly, but I get a lot of comments about my teeth, and I'm not sure if my jaw has realigned or something, but anyway, people do comment on, get your teeth fixed. Well, one, it's extraordinarily expensive to get your teeth fixed. And two, how they look for me at this point in my life with two children to look after is quite low on my priority list, to be honest. I mean, if I won Powerball, yeah, sure, but the health of them is really important to me. So the background with my teeth is that I grew up with no fluoride in the water. So we had rainwater when I grew up, and my parents didn't believe in either sunscreen or toothpaste or brushing your teeth. So the long story short, I've actually got quite bad teeth. I started looking after them really well myself. And you know what? I think this is the time I started to look after them really well. It was back in, I can't remember when it was, but I do remember I had a really bad toothache on this side. I think it was Boxing Day even. I know it was during the holidays, which was a real shame because I remember we had an outing that day and I had to endure the entire day with a really, really bad toothache. In fact, I remember eating a meat pie on that day and thinking, oh, I wish I could enjoy this meat pie because my tooth was really hurting. So we went and had an emergency appointment at a dentist the next day when the dental surgery opened again in Victoria. And it was a really big cavity. And dentists always say that once you can feel the pain, it's, quite bad. Because if you can feel the pain, it means the bacteria or the decay has gotten close to the nerve. Excuse my voice. This is life with a toddler too. You get virus after virus. Honestly, you really do. We're just a petri dish at the moment. So then the dentist basically obviously drilled it all out, which was horrendously traumatic, and then put a filling in it. And so, I sort of got, just kind of recovered from that. Thought, okay, well, hopefully that's the end of it. Sure enough, the filling actually broke only a few weeks later, actually. So that caused a lot of distress. So we went to the movies and I remember I bit into something actually really soft, just a burger or something. And then I felt this big, lump, and you just know. That sinking feeling that something bad has happened in your mouth. So sure enough, the filling had all broken and come out. So hi Elsa, how are you? I think is that your name? Hi, thanks for joining the live stream. So I went back and they put in this new big white filling, and ever since then it has just not been quite right. Like, it hurts when I bite down on it. You know how sometimes if anyone else has experienced bad teeth or has bad teeth, there'll be one sort of dicky tooth that just bothers you, and this has always been a problem, but the filling hadn't fallen out again, and every time I go to visit the dentist, it's kind of like, it's okay. But I've got a lot of fillings in my teeth. So when that happened, it was so traumatic that I got online and actually found a new dental system that I actually adhere to. And so the good news is there's not a lot of bacteria. I should cut to the chase. So I'll show you my dental routine in a minute. But the bad news is I went to the dentist yesterday for my regular checkup. So apart from just the dull, sort of feeling sometimes when I bite down on this side, there was nothing unusual at all. So there was no new pain, which is always good. So I went to the dentist, two broken fillings. And look, to be honest, the last few months I had noticed a little sort of sharp bit in one of the fillings, but the last time that happened, it just needed grinding down. So I wasn't worried about it. I didn't obviously think that anything's really broken or anything. So that's the first thing he said when he looked in my mouth. 2 fillings that have broken up here, and they're the worst ones too. Hi, hello. Thank you so much. Honestly, thank you for your support. Thanks for the comments. Just thank you very, very much. I'm really genuinely grateful for the support that we're getting here. And yeah, just thank you. Thanks for leaving those comments. I can see them. They just popped up. So I went in, so where was I? Oh yeah, so 2, and they're the worst 2. So they're at the top, at the back. So they're the big ones. They're the big molars, and so the fillings are already really big. And when I say big, I say like about 80% of the top of the tooth. So they're already massive, Most of the tooth is filling. So they're broken, yay. And the third one is a little bit chipped. But it's a silver filling, and he was saying that the problem with silver fillings, is that they can, because it's got mercury in it, it's one of the older ones, they can shrink and expand when you eat something hot or cold, and they're actually really bad news, because I think I'm not sure if they can leak the actual material or not, but he recommended replacing it. And I know every time I go in for a checkup, the dentist will always recommend replacing the silver fillings. But look, it's really expensive, actually. Dental work is really expensive, and you don't get any coverage for it. So, or at least we don't have extras. We don't have insurance that will cover it. So, unless it's really essential, I certainly don't get unessential dental work. But the 2 broken fillings are essential. And then he was saying he can do them in the one visit. And then he recommended that at the same time, because all these 3 teeth are in a row. So they're at the back here, 1, 2, 3. And the last one is like the final one. So not only are they deep and they're big, they're very awkward. So instead of just being able to open your mouth a little bit and he can just work here, it is just the worst position ever. Like fillings at the back here are just awful. I'm going to cry if I talk about this more. I'm honestly serious. I have got such a phobia about dentists. Yesterday, I was in the dental chair. I kid you not, I'm actually trembling. That's the honest truth. Like, I could feel my heart racing. I always get really sweaty. I'm actually visibly shaking. And every time I go, it's so horrible, because it's a thing that is ongoing. Like, I can't just go in once and get everything fixed. And I walk out of the dentist's office and I think I will never have to go to the dentist again. It's not like that. I can never totally forget it. Every time I brush my teeth, it's always, oh, when's my next checkup going to be? What are they going to find this time? So it's something that's like kind of always there. Anyway. So the bad news continues, by the way. So all these 3 are going to be done. They're going to be done together. I booked the first available appointment just so I don't have to dread this too much, because the wait is the worst. It's like when you get a blood test or something and they're looking for something really bad. It's the wait that's the worst. So waiting for this procedure is the worst. I think about it. It was only yesterday, by the way, that I went to the dentist. So I'll be thinking about it tonight. I'll be thinking about it first thing tomorrow morning when I wake up. I'll be thinking about it on my walk. It's just, So I booked the first available appointment, which is this Friday. And the dentist has said, actually, we can get some footage of it. So we will actually be getting some footage of it, because it's going to be an interesting procedure, all fear and phobia aside. And so basically he's going to do all 3 at once. And then he took an x-ray. So this is where, this is good and bad news. So the problem with a broken filling is that once it breaks or splits, infiltration starts to occur. So obviously liquid, saliva, minute bits of food, whatever that's in your mouth is going to, there's going to be some tiny seepage. And so then there's the risk, obviously, of bacteria, because bacteria is so tiny. Now, so the good news, so this is the good news. Because I've got a really good dental regime, which I'm going to show you in a minute, there was actually minimal bacteria. So that's very, very good news. So he did take an x-ray. There was only a little bit of a shadow there. So when he takes out these massive, ginormous, Titanic-sized fillings, he's not going to have to do much more drilling. So that's good, because you really want to avoid losing too much of your natural tooth, because look, nothing will replace it. Hi, thanks for your comment. I just saw it pop up. Thank you. Because nothing will replace your enamel and your tooth. That's the best. Like, there's just no artificial tooth is going to be as good as your own tooth. So that's the good news. I won't lose too much more, hopefully. However, the bad news is that this white filling, which has always caused me problems, it's very, very close to the nerve. And I didn't really realise it at the time. So I just, when I did go in there years ago to get it fixed, they didn't show me an x-ray of it or anything. I knew it hurt, but I didn't understand dentistry as much. It was quite a few years ago. So at the time, I just got it fixed. Now I've seen an x-ray of it, and the decay or the filling goes right very close to the nerve. And the bad news with this one is that because they all have little bits of decay underneath, good news, not much. Bad news for the white filling, though, is that any bits of bacteria under this really, really deep white filling that is very close to the nerve already is very bad news for the nerve. So so this could lead to a root canal, basically, because if the root canal gets infected, that's when you're in trouble. And the even worse news about a procedure like this is that it can actually lead to infection in your root canal. So not only am I going to be put through utter torture on Friday, which I'm genuinely dreading, just the procedure itself. I mean, dentists take every precaution, obviously. Like they wash out the cavity with a whole stack of solutions that's going to hopefully kill all the bacteria. But look, bacteria is pervasive, isn't it? Like, it's in the air. So it's not 1000% guaranteed. In fact, it's probably not even 100% guaranteed. In fact, it may not even be 80% guaranteed that new bacteria won't then get into the root canal just because of this procedure. And that can then lead to pain, obviously, and going back and getting a root canal, which is my biggest nightmare. My brother's had a root canal. If anyone's had a root canal, leave me a comment, tell me what it was like. I really, really hope it doesn't come to that. There is a chance, though, that it will. So I'm having it all done at once. He's going to put this big dental dam in my mouth, so that's going to be interesting. So if anyone's checked out the dental video that we did with Gary, because he's got 3 appointments actually. He's had the first one, which was a tooth extraction. Then he's going to get a dental implant, so that's the second one, and that's actually coming up. And then a third one. I'm not sure what the third one will be. Probably just a checkup to make sure the implant's correctly sitting in there or healing. But if anyone's seen that video, you'll know. Oh, actually, you know what? I've just lost my train of thought. It's sleeplessness. I don't know what I was going to say about it. I have no idea. I've utterly lost my train of thought with that. I was going to say something about Gary's procedure. But basically that's one. Sorry, I've totally lost that train of thought. I have no idea what I was going to say. Oh yes, now I do. Thank you, brain, for finally working. I'm sorry, it's baby brain, it's sleeplessness. So I finally remembered. If you've seen that video, you'll see that Gary's mouth was held open with this really big sort of thing that I've never actually seen before. But I think it isolates the area that they're working on and keeps it dry, or as dry as possible, and just keeps the mouth as wide open as possible. So that's what I'll be wearing. My dentist, his name's Andreas. Hi. Thank you so much for your support. I've just seen another comment pop up. I think he called it a dental dam. So it's going to have my mouth open really wide. So the procedure's going to take about 90 minutes, and it's going to cost about $1,000. So that really is bad news. It's like bad news all round. I mean, I know that I'm extraordinarily lucky to be able to get good dental health. but it's very hard to feel lucky when you've genuinely got a bit of a phobia. So I actually do, I'm so scared of going to the dentist. I really do. I sweat in the waiting room. I can hear the drill. And it's horrendous, getting 3 done at once. So he's going to be drilling anyway, like I said, I'm going to cry if I think about it. Seriously, I cried after the appointment. I did. I honestly did. This is really bad news for me. I mean, probably it's bad news. It would be bad news for a lot of people, unless you really don't care about going to the dentist. But I think most people do. I've never met anyone that likes going. So that's my lot. I'm having a really bad week. This is just the icing on the cake of a terrible week. So if anyone else is having a really bad week, this is my week, has become even more stressful and just something that I'm just really dreading. So that is coming up on Friday. But anyway, on a more positive note, so it was actually good news that I didn't have much bacteria in my mouth. And this is the routine. So I've been meaning to do a video on this for so long, but anyone with kids knows time just disappears, basically. I don't know where it goes, and so it is difficult to fit in time. So this is the routine I follow, and it's dentist prescribed. My throat really is bad. I'm sorry. So step 1, which it is annoying though, because my tooth routine does take a little while. But step 1, I use this rinse. So this is Clossie's. It says unflavoured mouth rinse. It cleans and soothes, so it's antibacterial, but I think it targets, I'm not sure, I should have actually looked it up, but this is what I use. It targets, I think, anaerobic bacteria, that the bacteria that can thrive or survive without oxygen. So I use this first, and I usually swish it around my mouth probably for a good minute. So this really does clean your mouth, but not only does it clean your mouth, it actually creates an alkaline environment in your mouth, because anyone that knows a little bit about teeth knows that you shouldn't actually brush straight after eating, because your enamel does temporarily soften. Nor should you brush if your mouth is too acidic, because that's then abrading away at your tooth enamel. So this will get your mouth clean and alkaline. Next step, and this is also my whole regime is dentist prescribed. I actually use a toothpaste called Crest. I buy it online, so you can't buy it from Australia. You can easily get it in America though. I'm not sure what other countries. I do order it online, and I just get a big pack of it every time. I'm not sure why the dentist prescribed Crest. I think it's something to do with the ingredients of this toothpaste. I better not say too much about it, because I'm going to say something wrong accidentally. If you are interested though in this regime, do look up Crest, because there must be a reason the dentist recommended it. Electric toothbrush. So the dentist said I've got a high risk of erosion. So he did recommend using an electric toothbrush, because apparently that cuts down on the chances of erosion, so you can just be a little bit gentler. Then after brushing without rinsing with water, so I've still got toothpaste in my mouth, I then use Listerine. So if Listerine is too strong for your mouth, you can actually dilute it. So I actually do dilute it. I have about maybe half Listerine, half warm water. And I'll rinse Listerine for, I never use the full minute, because when I was using the minute, my mouth actually turned black. So I think I was killing all the good bacteria as well as the bad. So I now only swish for about maybe 20 seconds, 30 seconds. And that seems to be enough. And diluted Listerine. So that's step 1, 2, 3. So then the 4th step, it used to be my last step until another dentist recommended one more thing, but this is a fluoride rinse, and I use it straight after Listerine. So again, no rinsing with water in between. You go straight from Listerine, spit that out, pop some fluoride rinse in, because apparently fluoride works better in an acidic environment. And I'm not sure why that is. I mean, fluoride acts as a carrier. So obviously the best protection for your teeth is your own saliva, because that's got all the calcium and phosphate and whatever minerals that your teeth need. But apparently fluoride acts as a carrier. So whatever's in your saliva that's good that your teeth need will be carried in more effectively if you've got fluoride rinse. I'm pretty sure that's accurate, but do look it up. But anyway, and this is not only any fluoride rinse, this is ACT fluoride rinse. So apparently the brands do matter. So this is exactly what the dentist recommended. Clossie's, brush with Crest, Listerine, and then finish with that. Now, one more thing I do now is, especially while I'm breastfeeding, because estrogen levels are really low when you're breastfeeding, and that can affect your saliva and it can cause dry mouth. So I use tooth mousse. So this tooth mousse is from GC Tooth Mousse. I think there are different types of tooth mousses you can use, but again, a dentist recommended this. And this contains calcium and phosphate. And so if you do have a little bit of a dry mouth, you sort of just pop this on your teeth. You can spit it out after a minute, but obviously the residual is fine. And that will help put more minerals into your teeth to just prevent further erosion. I did ask yesterday, I said to the dentist, is it going to rebuild your teeth? And he goes, no, it's not going to rebuild your teeth, but it is going to prevent further erosion. So there you go. I do use tooth mousse. I did Google this though, and some sites do say that it can reverse small cavities. So who knows? I might have worse teeth if I wasn't using tooth mousse. So I don't have any new cavities. I mean, that's obviously the really good news, but I tell you what, getting these huge ones out and then, I don't want to talk about it. I mean, I already have talked about it a lot. Another thing I use is xylitol. So xylitol has got a lot of dental benefits because, and this could be one reason my mouth is quite clean too, which is really good news. Xylitol kills, I think it's the strep mutans bacteria that cause cavities in your mouth. So I think they're the plaque-causing bacteria. But basically, xylitol is very much like sugar. I don't know if you can see it here, but it's granulated. This is an unopened packet. There's many different brands of xylitol. I don't stick to any one brand. I'll actually just buy whatever's at the health food shop at the time. But you can also get xylitol mints. I do usually buy this brand just because it's really the only brand I can find. They're Epic xylitol mints. And interestingly, this has also got xylitol in it. So dentist prescribed products also have xylitol in them, or some. So xylitol, I think, is just helping to keep my mouth healthy. And there's an interesting story behind xylitol too, because I'm from Finland, so I have a Scandinavian background. And xylitol was actually discovered in Finland because it's not an artificial sweetener, which is what everyone thinks. It actually comes from the bark of birch trees, very similar to cinnamon. And it was discovered during the war because Finland ran low on sugar. And so I don't know how they discovered that xylitol from birch trees was a sweet substance, but they did. And they started using xylitol instead of sugar as an alternative sweetener. And then they noticed that the rate of cavities had fairly significantly dropped in the country. And someone obviously with more brains than I do have put two and two together and worked out that it was actually the xylitol. And then obviously they did research on it, and it has been discovered that yes, xylitol does have dental benefits. Pop it into Google and you'll see that for sure. But so that's my dental regime. Now there's one more thing I use, and I meant to bring it over to the table with me, so I'm just going to grab it. So if you just bear with me for 1 second. I mean, there's cranes at the back there that you can have a look. So there's one more thing that I am going to use, and I actually have interviewed another dentist who speaks a lot about red light therapy for dental benefits. And I use just a lamp, a red light therapy lamp. And you can see, I think I'm using the lamp in, I'm just trying to think what video you'll be able to see it in. Recovering from a blepharoplasty. You can actually see me in front of the light lamp. And I was giving Spencer some red light therapy with it the other day. I set it behind his high chair. So you'll be able to see that too. So I do have a red light therapy lamp. It's a mobile lamp on wheels. But this is a handheld laser. And it's not good for eyes though. So I'll just turn it on. But red light therapy has a strong antibacterial effect. And when I looked up red light therapy for dental health, I mean, they're doing studies on putting red light therapy right in to sort of the tooth with very fine, I think, almost like a tube or something, like I don't know how they administer it. I've never seen something like that. But look, I figure because red light therapy can actually penetrate the skull for Alzheimer's and Parkinson's, I figured that treating the side of this with red light therapy, that's Piper, treating the side of my, I'll try and avoid, so you can see I'm just pointing it here, so because this is obviously where the teeth is. So this is going to get through my skin and it will hit my teeth. I mean, look, at the very least, one, it's not going to hurt for sure. Two, it's going to benefit my skin anyway. Three, it will benefit my gums as well. And four, it might also help with preventing any further sort of bacteria here where these fillings need to be worked on. And after the procedure, I'll definitely be administering red light therapy here as well. So this is also something I'll be using. And plus, I do use that light box for my skin when I'm using my tripolar Stop VX. So look, who knows? I mean, that could have also benefited to the good news that I had a very clean mouth. And in fact, all throughout my pregnancy, I never went to the dentist at all because I didn't want any dental work while I was pregnant with Spencer. And then afterwards, I was thinking, oh, I'm sure I must have a new cavity because, but I did use my dental regime while I was pregnant. And then I thought, I'm sure to have a new cavity because obviously I haven't gone for so long. But thankfully, I didn't have any new cavities. And even my husband, Luke, who's an obstetrician, was saying, the saying goes that you lose a tooth for every pregnancy. Maybe this is the tooth I'm now going to lose. No, it is 18 months down the track now, so I don't think it's the pregnancy's fault. But it's Piper. But I didn't have any new cavities then. There was a visit before I got pregnant. I went there just before I went to the fertility clinic just to get my teeth all as healthy as possible with the hopes that we would succeed, which we did. And there was no new cavities then. I've been twice since Spencer's been born and there's been no new cavities. So that's actually very good news. So I think keeping my mouth really clean with this regime that I use and xylitol mints, and probably the knock-on effects of any red light therapy that I'm using is probably really helping cut down on mouth bacteria, which is the cause of decay. But unfortunately, there is those shadows under the fillings, and plus the fillings are broken anyway, so they've got to be replaced. And the silver one, it's very recommended to get rid of that one anyway. And there is some bacteria under the silver one. So I'm just rambling now, but look, if anyone's been to the dentist, or if anyone's got a dental phobia, or if anyone needs to go to the dentist and is putting it off, oh wow, I hear you. It is so bad. Like, I mean, in terms of big problems, it's a manageable one, obviously, but just the fear that it causes, like, it causes me so much fear, and it's horrible. It's really horrible to be sitting there. Oh, one more thing I was going to say, I'm having happy gas with it too, and I've never had happy gas. So it's going to take 90 minutes. We are getting footage of it. I'm going to be under gas. I have no idea what happy gas is like actually for a dental procedure. So if you have had happy gas, please leave me a comment and tell me what it was like. Like, was it okay? And 90 minutes. And I have no idea how I'm going to keep my mouth even open for that long, because even a teeth cleaning, my jaw is just so sore at the end of that. And there's just going to be a point in the middle of this procedure. Anyway, I really hope the gas works. I hope I'm so out of it. I'm just going to take a deep breath. Anyway, I just wanted to do an update because it is hard sometimes to get on and process videos. And so I just wanted to do a real-time update. So this is what's going on in my life right this very minute. So I'm dreading it. So it's on Friday and we are getting footage of it. So you will then see. I'm really hoping at the end. So this is what I'll be thinking about, because I'll just think, I really hope at the end that I'll be able to say something positive about it. Like, I really hope that I'll be able to walk out of there with all my teeth fixed and say, look, that wasn't as bad as I was fearing. The only thing about dentists, that was actually just my red light. The only thing I've learned about dentists is it's usually worse. But I won't think about that. I'm going to think about that every hour till it's over. So how many more days have I got? So it's Tuesday today, Wednesday, Thursday, and then Friday. So I did book at the first available. So anyway, wish me luck, guys. Just thank you also so much for your support. This is actually actually my new nursing dress. So the 2 p.m. video that ran today, if you've seen that, this is one of the dresses. And this is actually the first time I've worn it. So we do try to put videos up as quickly as possible so that they're still relevant, unless there's Throwback Thursday videos, which I'm more working on, actually, to be honest. Like, I like the idea of a Throwback Thursday where you sort of look back on things that have happened earlier. And obviously there's a lot of footage of Spencer too that just have not had time to process. So there will be a lot of clips and videos of him younger as well. And you'll be able to tell anyway if you follow the channel that he was younger then. But I've got some delightful footage, and I love going over the footage. I can't tell you how much I love it. Like the other night, actually, I found a clip that I would have filmed probably over a year ago, and it's Spencer and Piper, and it's so funny. I won't tell you much about it because it will be coming up. I have now scheduled it, but it is really funny, and I loved watching it. I loved watching it myself, so it just brought back all these memories. It's such a joy to edit, and I was just looking at him and thinking, oh, he's so cute. And I actually called it was so funny. Luke was looking after Spencer at the time, like giving him dinner in the high chair, which is always a disaster with a toddler. And I actually called Luke over and I said, oh, look at this, he's so cute. And Luke said, well, you can come out and actually enjoy the real thing. Touche. But anyway, so thank you so much for your support, guys. So that's what's going on in my life right now. It's really shit. Like, it really is. But hopefully, maybe next, well, I don't know when I'll go live next. I mean, stay tuned. I'll try and jump online a little bit more, to be honest, because going online is a good way to just keep you updated on what's going on in real time. But anyway, stay tuned. Next time I go live, I'll try to remember to tell you what's going on with it. And also the video will be coming too of this very traumatic procedure. And Piper is just barking, and let's go and check him out because I think he wants to say goodbye. Actually, I'll bring it over here. Oh, and the cranes. You can probably see the cranes in the background. So this white, the white bit has raised. And Gary, if you jump on and watch this, the bit Gary was talking to me about the crane at the front is going to raise. It hasn't raised yet, so it's still actually on the level that it was. All right, I'm going to move this over here so you can see Piper. Actually, what's easier? I don't know. I'm pretty hopeless with turning it around. There he is. There's Piper. Piper's being a good guard dog. Piper's being a good guard dog. And every time I look at these windows, I'm a little bit dismayed. We actually need them cleaned, but there you go. There's Piper. So thank you so much for your support, guys. And I will now say goodbye. I am pretty bad with turning this around. Where are we? Oh, we're still there. Oh, Piper, be quiet, please. Anyway, thank you for your support. That's what's going on now. Gary, if you do see this, travel safe. He's in Vietnam at the moment, so he's very lucky. And see you later, guys. Wish me luck. And, I just got another comment. No, Spencer's actually in daycare today. He is coming home soon though. So I better stop what I'm doing and just sort of get ready for him to come home because I can't wait to see him. I miss him when he's in daycare. Okay, bye, guys. I will see you again. Stay tuned for more live streaming and videos and shorts and as much as we can. And just thank you. Thank you so much. See ya. Bye.